Hey, welcome to Shop Talk. I'm Brandi.
This is James, and we talk about all things related to cross-cultural workers and mental health.
Great. We're glad you're here. And welcome to season 2. We've made it to season 2.
Yeah.
Yay. Hey, everyone. Thanks for joining us today for Shop Talk with James and Brandi. Thinking this is going to be our last podcast of 2022. And we'll see what 2023 brings. I'm excited about it. So today we have a special guest. Are you ready for it? James Covey's joining us today.
Wow.
Wow. Thanks for being on our show. We've really tried to make this work several times now, so I'm really glad it worked with your schedule.
Well, we thank you for having me.
You recently attended the Mental Health and Missions Conference, and you also had an opportunity to present there. I wonder if you could tell us a little bit about how that went and what you presented on.
Absolutely. I got to talk about care during COVID, kind of based on what we did and learned as mental health providers for cross-cultural workers, and also knowing that there's some stuff that happened globally that we can learn from, and we've actually are going to implement and continuing doing as organizations striving to care for our staff in difficult places. And then there's some things that were like, my goodness, can we please stop doing this? Like, is the pandemic over? Are we done yet?
Right.
Like I keep saying stuff that happened last year that happened in 2019. I can't do that anymore.
That's a good thought. Is the pandemic over yet? I mean, is it? Okay, so there was some scientific documentary, because Tracy and I are nerds, we were watching, and they're talking about germs and illnesses, and it was made in 2019. And we're like, oh no, you just don't know yet, do you? It's almost painful to watch it.
Yeah, but you could send them a message
from the future. You don't even know. All right, so tell me about your presentation, just some of the things you covered in it.
Yeah, I kind of pulled 4 lessons out of key components of things that we've learned, things we're going to grow and change and move away from or towards. And the first lesson is virtual engagement. We're doing it right now. And so much of our world is now really about virtual engagement. And my hypothesis, not like a researched one, but just kind of my fun way of engaging the topic, is that everyone is more tech aware or engaged than they were before. And that we're probably never going to return to a pre-pandemic level of in-person work or engagement, but that how we do virtual stuff, we can actually do it in a healthy way.
Okay. So what do you think are some healthy ways we can do virtual stuff?
One of the things we've learned is that virtual works, like it's effective. There are elements of how we're providing care. And even from the counseling and mental health side, there was 39% in this one study of 800 therapists that were using telepsychology before the pandemic, and it went up to 98% during the pandemic. So
wow.
What
are those other 2%? Yeah, like, what are they doing?
They were on sabbatical. Nothing else makes sense.
Well, it's huge.
Yeah, and I think initially everybody was just saying, "Oh, it's not as good." We're comparing virtual to in-person. We're saying in-person's better. Well, the accurate comparison is actually virtual versus nothing. So it's not even comparison. In nearly all cases, virtual is actually better than nothing. But we're even learning now that actually virtual in many ways is really effective, and it doesn't need to be compared to better or worse than in person, but just standing on its own saying, hey, this is actually a very viable way to provide care.
Right.
One study I saw, in May 2020, 74% of mental health related bookings were virtual. The next year, 85%. And then this past May in 2022 is 87%. So they interviewed 400 patients and 200 providers, and it's actually increasing, even though for a lot of people, this past May was really kind of post-pandemic life, but a lot of both therapists and clients are preferring this virtual engagement.
Right. So even though restrictions have in a lot of places gone down or gone away, people are choosing to continue virtual engagement. Yeah. And that's surprising to me.
What would you say are some of the benefits of virtual care? Let's do counseling. Like specifically, what are some benefits of virtual counseling?
Well, you can see a wider variety of people at different times. So you're flexible. You can see someone who's maybe has a harder time getting to you in person. So if someone is like with our organization, if they're a couple of countries away and they're not able to get on a plane and come see you, or that doesn't make sense financially for them, you can do that too. So I think that's great. And I think it cuts down on a lot of cost also.
in either per session or in traveling, or a lot of our people that are based overseas are either having to go to an intensive somewhere. Now they're able to have any therapist in any language they prefer from anywhere in the world in their living room.
Right. There's a gal we interviewed, and I interviewed last year, Paula Wong, who has a particular psychoanalysis approach to therapy. So she has her clients lay on a couch, and that's very much a part of her approach as she's talking to them. And she says she's figured out a way to make that work virtually. And at first she thought that's not going to work, but she has figured out how to make that work. So it's encouraging.
Well, and one of the benefits of how long really the pandemic took is that we now have a lot of research. People immediately started tracking some of this stuff. What would you say are some drawbacks?
Poor internet connection.
Oh my gosh.
And especially with counseling, you don't want to have someone in a really intense moment say, wait, can you say it again? Or I missed the last 2 minutes of that, or have something freeze up. And that's really frustrating.
Honestly, right before we started recording this, I was in a session virtually and I had internet stuff. And
right.
I'm hearing him fine, but then he's not hearing me. So I turn my video off and rephrase the question and talk about losing momentum.
Oh, right. If you spend a good percentage of your session together trying to figure out technicality or the technical aspects of it, it really takes away from your ability to connect with each other.
Yes.
We can even talk about how we recorded this podcast a few days ago and it didn't work because of technical issues. I worked with students at Black Forest Academy, and there are different times when we had virtual schooling if COVID cases were high and whatnot, especially meeting with students in a dorm. And the bandwidth is being taken up with students trying to go to class. And so trying to meet with someone, and we're both trying to have our video on, and it was next to impossible to have just really good connection. I mean, literally with each other. And I just felt like, oh my gosh, okay, we're checking in. We're just trying to get the highlights here. If we could do that, I'm going to call that a win.
Right. There's so many challenges of that. There's some licensing challenges of, can I meet with this person if they're in this place? For most countries, counseling takes place where the patient is, where the person is. So state licensings in the US at least have some limitations. You're trying to figure out those things, and then people might move or go to different places. Right. There's a loss of physical cues. We can't see all of the person. Like a teenager, they might be doing the death grip on their chair and you're missing it, that they're actually kind of maxed out in their ability to handle it. For me personally, I'm a little more hesitant to do counseling of adolescents virtually, especially if I don't know their environment at all, because a lot of times when you're counseling a teenager, they can kind of decompensate or get a little bit worse when you're talking about whatever it is that's difficult for them. Right. And if part of their problem is their family system and you don't have any input into their family system, what are you releasing them from when they potentially leave therapy in a little more unstable place? So
exactly. And I had students that did not want to meet virtually because they were at home with their parents, and they didn't feel like they could be as honest and open if the relationship with their parents was something they really wanted to talk about. Like, they couldn't be 100% sure from their side that their parents couldn't hear them talk about them. So it can be tricky.
Can be.
Yeah.
There was a study done by the Veterans Administration in the US showing improvement of vets who were suffering from PTSD and receiving virtual counseling. This was actually 2018, 2019. So even before the pandemic, already seeing, marketable and significant improvement through virtual therapy. So even with these success and challenges, I think it's here to stay.
I agree it is. I thought of another plus that, sometimes people feel like going to a therapist's office feels like there's a stigma associated with that. And so we can meet with someone virtually. There's not that concern of who's going to see me going in, who's going to also be in the waiting room, do I have to make eye contact with them, and all of that. So it can be a little bit more private from that point.
Yeah. Which is allows people to feel safe, which means they may be more likely to be in a better place once they get started. And
True. Yeah, it's interesting.
I think that, at least for me, and this won't be true for everybody, that there's a little bit more of a cost to the practitioner or to the therapist. Like for me, it cost me more in my own psychology and physical self as I do Zoom counseling versus doing it in person. And there's now like some studies on Zoom fatigue and how Zoom is impacting us, because people have worked on computers for decades now. we'll put an 18-hour day on a computer. And so it's not specifically being on a computer. It's something about this video interface that's more draining on our brain. The signals of looking at ourselves in the reflection, all of the different people. I mean, if you think about a Zoom, to recreate that in person, my face would be so close to your face. Like, that is really uncomfortable and intimate.
It's really awkward. Well, talk about that a little bit more and how you recognize when you're starting to feel the fatigue of, meeting with people virtually and stuff.
The twitching that starts and doesn't stop. The bloodshot eyes.
Right.
Incessant yawning.
It's such a good point that maybe for the client, there's not as much of a cost for the client as it is for the provider.
Right. Especially when we start stacking them. Like, I'll have 7 hours of Zoom a day and be toast.
Right.
But I think you can kind of measure it. Like, for me, I know that to do an hour of Zoom costs me about an hour and 15 of normal kind of work. And my wife, Ellie, is a little more impacted by video conferencing. For her, it's probably an hour and a half. So if I were to listen and practice what I preach, I would have at least a 15-minute break kind of in between sessions, or different ways of orchestrating my day. I might not do as much Zoom counseling as I could do in person. So ways to kind of balance what I have discovered as my own cost.
Right.
It's not a 1-to-1. It's not an hour of Zoom equals an hour of in person.
Right. I feel like we should drill that into our own heads,
Oh, I know.
other people's heads too. Like, this isn't a 1-to-1 thing. It really is.
Normal counselors do 50-minute sessions. Why do I book all of my meetings and counseling sessions for an hour?
Yeah, that's a good question.
Oh, I know why. It's because it takes longer in the creation of like the calendar appointment to do 50 minutes, because it's auto 15 minutes. I don't want to take the extra 73 seconds it would take to make a 50-minute session.
Well, I know that when I worked at the school, I had to go in and manually put in the times in our shared calendar. And I'm like, I gotta do that. So let's look at your next lesson that you talked about.
Working remotely. I think as we look at both working remotely and this kind of virtual engagement, the real winner in all of this is the cross-cultural workers, because suddenly the entire world now operated in the same way, at least for a short amount of time. They were disconnected from family and friends. They were doing a ton of stuff virtually. They had to operate in a different cultural environment, which was kind of this whole connection, virtual, can I leave my house? Can I not leave my house? And tons of people and organizations and churches and governments put tons of resources available online.
That's true. I mean, you were seeing all the stuff online, like virtual concerts and museum tours and just all kinds of stuff, like when COVID first hit.
People doing games together. All of a sudden, most of our support networks from our Sydney country now had at least in their head, the idea of how to connect, which was kind of new and fun.
It is fun. And now, who doesn't have Zoom? Like, I feel like everybody has a Zoom account.
My grandparents, who are 88 and 92, can click on a Zoom link. And if they can use it, anybody can use it.
I love that.
Yeah, they're on it. So working remotely, something we were doing in our organization already, but we're never going to return to a pre-pandemic level of in-person work. But similarly, I think there's ways we can do it that are healthy.
I think that is something, again, to drill into our minds. Is the before is before. We're moving into a different normal now. That's like, we're not going to go back to the same ways of working that we had before.
Right. Probably some hybrid, and we'll look into some of the reasons why. I think that there's some of the stuff we did in SIL was we were setting up more frequent interactions. I think a lot of people did like community cafes and connecting points, and we did a lot on psychological safety. Like, how do we create safe environments for teams that work together when you don't get those in-person opportunities to build trust and to build psychological safety? Lots of learning at how to do working remotely healthy. Like, how many trainings have you been to where it's just a talking head on Zoom for an hour?
Oh, right. Gosh, that's the worst.
Yeah. And I think part of that is both on the participant and on the facilitator to create an environment virtually that encourages what we know is adult learning. Like, there's times where I show up and I want to mail it in. So when they put us in breakout rooms, I'm like, oh, I don't want to do this. But it helps me be more engaged and learn. So
exactly. Honestly, too, like when we have group meetings and you recommend breakout rooms, I'm like, come on, James. But we do, it does force you to interact more. Now I've told you my secret. But that is a good point about working remotely, that it's a little bit easier to tune out, that
Mhm.
you have to be extra mindful about paying attention and being involved.
Right, which is both the facilitator's responsibility and I think the participant.
Mhm. I think that goes with counseling because
Yeah.
you're not getting different cues from the person and like their body language and such that you have to again put more effort into connecting, which is why it takes more out of the provider.
This reminds me of a study I read about in the Culture Code by Daniel Coyle, of a study that was done in Cold War era research and development laboratories in the United States by Dr. Thomas Allen, looking for what made teams more productive. He assessed for all kinds of demographics, education level, and what he found was the difference was actually the distance of the desk. So the Allen curve was developed based on how far apart the desks were, because the closer members' desks were to each other, the higher frequency their communication, which was a significant part of their productivity. So the more frequent they were communicating and interacting, created by the closeness of the desk, the more productive the team was.
So part of the challenge remotely is to actually figure out how to increase the opportunities for connection for these virtual work teams.
And I wonder too if virtual teams can just leave that tab open and work together that way during the day. Like, would that work?
Yeah, I think there's tons of different ways to do it. The goal is increased connection. So like Tracy, your husband's team, they get together every day for 15 minutes. A
Hmm.
touch point every day. Our team,
Hmm.
we have once a week, 30 minutes, just kind of like trying to recreate that coffee break, water cooler conversation that in addition to like business or team meetings or individual stuff, that whoever's around can just kind of show up. And I think there's ways to help do that. And there was a ton of research done on this, especially over the last couple of years. Stanford did a survey of 16,000 workers over 9 months, found that working from home increased productivity by 13%.
Hmm.
Some of these studies are coming out with people are working longer hours, they have improved work-life balance, they're reporting less stress. So you have some of this stuff that especially initially has a short-term productivity increase,
Hmm.
but that doesn't always maintain. And if you have work that's specifically connected to team function, you actually see a decrease in creativity and a bit of a decrease in team productivity. If you're, I don't know, a consultant out there working on your own, working from home is great. If you're connecting to a team, you need each other, you need that creativity that comes from being together. That's really hard to recreate virtually.
That's one of the things where I think we don't want to completely let go of face-to-face interactions because the creativity and the team building is so important and kind of hard to replicate over Zoom.
And I think there's a way to do it more economically. One of the things we're doing in our organization a lot is sending one person to connect with one person rather than always flying like a whole bunch of people to a spot, to try to looking what are some ways that we can have some connection without everybody connecting. And if
Mhm.
you go and connect with this person and they go there, there's some of that creativity that's happening in a more kind of cost effective and easier to plan way, as we still have some challenges traveling.
And I don't want to diminish the negative impacts of COVID because it's been huge in that way. But also look at all the research that's come out of this and look all that we've learned that we've been forced to learn because of it. It's pretty amazing. So another thing you think about working remotely, a benefit of that is what we our organization called creation care, which is being mindful and proactive about caring for the environment and caring for the world that God's created and loves and has given us. So with creation care, we just try to think about, do we have to meet in person? If we do, what are the ways we can do that that causes less of an impact on the environment? That is something that COVID has given us the chance to take a step back from, because we weren't able to meet in person. So we're able to take a step back from that and reevaluate as far as our relationship to the environment, how we can move forward if we are going to have some face-to-face meetings, how we can move forward in a way that cares more for the world that God's given us. I mean, as an example, when Tracy and I travel, we look at what's the carbon footprint going to be this way of traveling versus this way of traveling. And if it looks like we're going to travel by plane, we try to budget enough for some sort of carbon offset or something like that.
I think there's some wisdom and some ways to save both in the what we're costing the world around us, but also our own pocketbooks and our organizations.
Right.
And then I think there's some learning that we've also done in how to prioritize what we do when we are together, because there's a ton of stuff we can do online. Our teams often will do all of the work stuff that we can do reasonably virtually, so that we're in person, we're connecting, we're hanging out, we're doing some actually more fun team building stuff that's going to help us grow in our psychological safety on a team and our ability to trust each other. And that's actually a more effective way to value our in-person time when many of us are working in more remote ways than we were previously.
Right. You know what, when our team meeting, when you were saying, well, we may not meet in person this year. And I thought, well, boo. And I went to Tracy. I was like, well, yeah, we might be able to meet in person. I'm mad about that. And he said, no, this is okay. This is part of the initiative organization. Okay, fine.
We did a training, and I think not all trainings should be done virtually, because some of them, you actually need some of those in-person ways to learn, especially things related to staff care and to counseling. We did a training called Leading Constructively in Conflict, and we did a 3-day kind of 7 hours of content for 3 days in person. And then we took it virtually, and we realized that it wasn't an hour to an hour in terms of content comparability. So we stretched into 5 days. We took all of the content, reduced it by 20%, added more breaks, different times of connecting. And some of that connecting stuff takes more time, like going into breakout rooms, coming back, waiting for people to share, the occasional talking over each other. That all changes a little bit virtually. So I think when you're doing training specifically to reduce content and to increase the amount of engagement and breaks will help people be able to actually learn more effectively through that training environment.
And they'll want to go too. If the format works and is designed in that sort of way, people will want to participate.
Right. Or they're just going to go and feel totally zonked because all they did was listen and watch all of these screens.
Well, let's move on and let's look at some mental health impacts.
I was a part of a panel for the Well in Chiang Mai, Thailand. And one of the questions that we were answering as experts on this panel was, were people impacted by the pandemic? It's kind of like, yes.
Yes.
They were. There was a mental health impact. Now, we had one team leader who said it was the easiest crisis she's had to deal with in years. For her, that was true. Some of the other things they've dealt with have been way more traumatic, way more difficult. For her, the pandemic was a reduction of some of the cultural stressors she was having to navigate. Team life got simpler, expectations went down. So for her, it was simpler. But I think across the board, we all were challenged in mental health ways that I think some were actually really helpful, because it really normalized mental health. All of a sudden, 75% of the world wasn't okay. And they were willing to say, "Hi, I'm not doing okay. I need to talk to somebody."
That's a good point.
Increase access to care. I mean, there was everybody going online. Suddenly there's resources available. And I think that's pretty significant. I was seeing more clients because in addition to the stress of suddenly maybe living with a spouse you haven't been getting along with, or a roommate, or people also had more time because they lost a lot of the other things that filled up their life. So a little more stress, and then also actually time to deal with some things.
That is true. I know that, I don't know the exact numbers, but I know divorce rates increased during COVID because all of a sudden spouses are like, oh, hey, I'm with you all day. Actually, I don't really like you. Like, thankfully, I mean, Tracy and I really like each other. We're committed to each other, and it's going to be all right. But you see other people that their relationships fell apart during COVID.
I think part of it is because one of the impacts on our mental health is there was just additional things that we're having to think about all the time that are just kind of running under the surface on some level.
Right.
Whether you were in a country with a lot of restrictions and under the surface was, tomorrow, will I be able to go out of my house? Will I be able to get food? Will I be able to buy bread? Will I be able to travel? When will things go back to normal? When will I be able to get a shot or a booster or have a conversation or go to church or not go to church? And you could think of these as like tabs open on your computer. The more tabs you have on, the slower your computer runs, or more apps you have open on your phone runs slower.
Oh,
And
right.
it just became a lot harder to close some of these things that were running all the time.
Yeah, I remember talking to some folks that lived in the Caucasus region, and they had to ask permission on an app to go out. And I think the maximum was 20 minutes at a time. And there were people patrolling the streets who would look at your app to make sure you have permission to be out. And it was only enough time to get to the store and get back home. And I think you only got once a day you got to do that. So that was stressful. And then you're living with and working with teammates who may respond to this in very different ways and had different ideas about how to move forward with COVID. You want to be able to live and work well with them. And that can be really challenging when you've had this experience with COVID and people have had significant loss of people who are close to them because of COVID, and you're still trying to work with people who see it differently. It's stressful.
Yeah, and it impacted everybody in sometimes unique ways in how they navigated it.
Right. And those differences, like we see this a lot, those differences have been highlighted. It's become harder to bridge that divide with people. And I'm not saying COVID caused this, but COVID certainly brought a lot of things to the surface. And so it's taking a lot more work to meet people and say, I see you and I want to listen to you and understand you.
Great. It's been tough. You mentioned loss. And I think that's another thing that was increased was everybody had lots of extra losses. Henry Levinson said all change is loss and all loss must be mourned. And there was just a massive increase in losses, whether it was kids missing out on rites of passages that they'd expected, like playing sports in school or going to a dance or getting to transition or move or see people, or some of those things that are just losses and those kind of hidden losses that we don't always recognize every day just kept stacking up. And I think a lot of people lost access to some of the healthy ways they would have normally managed things like loss, like going to be with people or going to the gym or all kinds of different things that people lost access to. Mm-hmm. And yet we still have losses. I think even this Christmas, I think some of our singles on the field, in particular in different countries, may still be wrestling with some of those losses that have now been intensified, increase in loneliness. Mm-hmm. Already Christmas time, we see a huge increase in depression and suicides. That's well documented. And I think kind of on this tail end of the pandemic, people are still in that place of trying to figure out how to navigate all of these losses and what it means for them now.
Right. It's not like, even is the pandemic over? Who knows like when that cutoff date is, but even if it is over, we're still dealing with it. We're still dealing with the psychological impact of it. And we will be for some time.
In our brains, we think about our brain having two different parts. We'll for sure talk about this more as we get back into trauma. I loved having Phil on. That was a great deep dive.
Oh, it's so good. Yeah.
But our brains were really getting activated a lot through COVID, that kind of like, am I safe? Am I not safe? Our fight, flight, or freeze part of our brain. Mm-hmm. And, we're just not designed to be in this kind of survival place all the time. But for a lot of us, we're getting triggered for survival mode. Mm-hmm. What's happening? What do I do? How do I keep myself and my family safe? And that was just impacting, I think, the way that our brains normally function. We had an increase in stress and cortisol, and there's going to be kind of ongoing costs we're not so sure of until we get some more time behind us. Even for kids in their developing mind, how they dealt with this kind of perpetual ongoing state of uncertainty and fear.
Even when our brains get used to operating at this level of elevated cortisol, it's difficult to move down from that or move back from that because our systems, even if it's unhealthy, our systems get used to it. So it's going to take intentionality to
regain a healthy homeostasis, like better balance. I'm reading this book right now called The Upside of Stress. It's talking about all the benefits of stress, which is neither good nor bad. It's just our body's response to change. Mm-hmm. But I think there was such a significant amount of stressors in our brain being pushed into this kind of survival mode that wasn't great long-term health-wise for us. And I think as humanity, we're now trying to settle back down and figure out what is a healthy normal now. My last lesson was about collaboration and working together and seeing organizations jumping on and doing trainings. And the Well in Thailand had a great training for debriefing. So rather than put our own thing together, we used theirs, because I think a lot of us were like, hey, let's not all reinvent the wheel. Let's do what we're good at and invite others into what we do well, and then use others' organizations and counseling centers and virtual therapy to have a better resourced, broader community to care for our cross-cultural workers.
That's a great idea, especially if we're looking at mental health workers being pushed and stretched in ways we hadn't expected before to be able to collaborate and use these different resources. It's a great thing.
The Olive Tree in Italia, Turkey, and also Scentwell, where I'm at in Spain, both did tons of virtual care throughout the pandemic, but are now returning to places of really doing in-person short-term intensives because we see a ton of success. We're really regionally located in a way that's significant, and people have access to virtual counseling from places all over the world. So
Right.
we're really going to get to doing what we do best and what we do in a strategically significant location.
That's great. And you can hone that down to an area that you do well and the services
Right.
you provide well.
Yeah.
This has been so interesting, James. I'm wondering what surprised you as you were doing your research for this presentation? What surprised you or stood out for you?
I think going in, I just didn't have that expectation of the success of virtual care. I still had a little bit of, but let's get back to in-person as soon as we can, in-person trainings, in-person counseling, as much in-person work as we can. But I think what surprised me is there's now a ton of research saying, hey, actually, this stuff's working and there's ways to do it that are healthy and well balanced.
That surprised me too when I was looking through your presentation, because I've seen virtual therapy as a distant second or something
Right.
just to plug the holes in a boat, or something like that. But it can actually be really good and really effective.
And people are choosing it.
And there are lots of different options in virtual therapy too. I don't know if they're all great.
As we think about the holidays and Christmas and our cross-cultural workers that are spread out all over the world trying to figure out how to do the holidays, I think it's worth just noticing some of the challenges there. And I think some of the stuff we've learned about being remote and virtual is a part of how do you bring into people who are living really far from family some of those traditions or some of those pieces. It reminds me of the conversation we had last year on a podcast on Christmas traditions and how several of our different friends and colleagues have found ways to make it special. Do you have any thoughts on just kind of here we are in the holidays? What does it look like to be healthy?
Right. I think one thing is to look at, like, do you even like the holidays? And it doesn't mean to even like Jesus. Those are different things. So I feel like as followers of Christ, we feel this like burden to love Christmas. And maybe you just don't love Christmas. And that, again, doesn't mean that you're not
Scrooge McWelterlin over here.
Maybe December is just dark and you're tired of that, or you're tired of the cold weather or something like that. So just look at that, give yourself permission to be where you are, be curious about where you are, and just be okay with that.
I think a lot of it is about talking through expectations. So if you're single with roommates, if you're a part of a team, if you're a couple, if you're a family, to talk through what do you hope, what do you want, what do you know you're not going to get but is important, or what are the things you're letting go of. I think so much of it is about having a conversation and just say, you know what, it's actually really important to me that we wake up and open presents, or that we Zoom all of our family that we can. So how do we create time and space for that? And to just have those conversations about, hey, team, are we getting together to do something or are we not? Or if you're single, to say, I really want to be with somebody on Christmas Eve. That's my culture. That's important to me. Would someone be willing to do that with me, or to create it and invite people over to engage in those things that matter? So if it's not important, then you're not particularly upset when you don't have those opportunities. But if it is, to really be vocal about your expectations and desires and hopes with the people who are around you or who can connect with you virtually.
Yes. Be proactive about communicating your hopes with others.
Otherwise,
James,
you wind up like my 30th birthday all over again.
What happened on your 30th birthday?
I was like, hey, this one matters. I was in Kenya. I was like, I'm going to organize something. There was a new fast food place that opened. So messaged all of my friends and said, hey, let's gather after work, 7:00. Everybody show up that wants to, my birthday. And nobody showed up.
For the extrovert. Oh man.
So they were on their way and stuck in the infamous Nairobi traffic, but it was like 45 minutes where I was like, I'm hungry. I'm just going to eat by myself. Like here I was actually being vocal about my expectations, helping create space, and nobody showed up.
Oh, it's funny.
Yeah,
James, do you like decorating for Christmas? Do you get into the whole holiday thing?
I do. I'm all over it. I definitely take the initiative in our family of decorating and putting up the lights, and yeah, I like it.
We're in transition this year, so we're not.
Yeah, where are
we're
your decorations?
Nowhere. We're in Berlin temporarily, so we packed up all of our stuff, and our decorations are in the States. So I have one ornament here. So that's where we are.
Well, on that note, Merry Christmas to Brandi, Tracy, Max, and their one ornament.
And Max is like, "You didn't get a tree, Mom?" I was like, "No, I don't get a tree. There's nothing for on the tree." He's like, "Oh, Mom, get a tree." No, I'm not doing it.
Oh my gosh.
All right. Well, hey, it's good talking to you. Thanks for joining
Yes.
us on the show today.
That's right. Merry Christmas, everybody. And if you listen to this after Christmas, well, enjoy whatever day it is.
Right. Thanks for joining us.
Bye.
Bye. Tell me about your recent experience. You attended and presented a
Great start.
I appreciate it. You know what? Hit pause. I've got to blow my nose again. This isn't going to work. I'll be right back.
Whoa, did you hear that?
No, what was it?
It was a weird feedback.
Makes you nervous now, doesn't it?
It does.
Yeah, I can't do this again.